Good morning, everyone, and welcome to the IFS's second annual Scottish Budget event. So I'm David Phillips, and the IFS's head of Devolved and Local Government Finance Research, and also the editor of the report. And I'm delighted to welcome so many of you to today's event, where three of my colleagues and co-authors will present some of the key findings from the report, following which there'll be plenty of time to ask questions. Now, I won't say too much before handing over, but I did want to highlight the difficult fiscal environment facing the Scottish Government when setting both the 2024-25 budget and when looking into the medium term. As you'll hear shortly, higher than expected inflation has eroded the real terms value of UK government funding compared to initial plans, despite some top-ups to those plans. And the UK government has penciled in tight spending totals for the second half of the 2020s as it seeks to reduce the budget deficit it faces and eventually return the national debt to a declining path as a share of national income. So these external factors and UK government decisions do underlie the Scottish Government's budget. However, as we said last year as well, the way the Scottish Government presents its budget figures is not as clear as it should be about the changes in planned spending in the coming year and the trade-offs it's making. Not only us, but also the Scottish Fiscal Commission and the Scottish Parliament's Finance and Public Administration Committee all think that it is better to compare the coming year's budgets to the latest updated plans for the current financial year, not the original budgets. Yes, budgets for the coming year can be changed too, but when working out whether the plans may need to be changed or not, it surely makes more sense to compare them to what we think we're now going to spend on different services this year, not what we initially expected. Now, alongside today's event, we published a new mini report which looks at what changes we might expect spending plans in the coming year, 2024-25. And in particular, it looks like just over £200 million extra may have become available for spending in the next financial year already. And more may follow if English spending plans are topped up, or if income tax is reduced in the rest of the UK in Jeremy Hunt's budget next month. But just how much funding will become available and when that will become known is highly uncertain, which creates some issues for the Scottish Government. And there are ways in which UK Government can help reduce this uncertainty. But, of course, current spending plans are the current plans, so what we'll focus on today are those. And with that, let me introduce today's speakers. First up, we've got Bee Boileau, who will give an overview of the 2024 budget and the medium-term outlook for funding and the risks and trade-offs in that outlook. Then, Max Warner will look in more detail at long-term trends in health spending and more recent trends in hospital activity, productivity and performance. And then Kate Ogden will look at higher education funding. After that, we'll have plenty of time for questions. You can ask your questions using Slido. Please use the link in the event invitation or underneath the live stream in the IFS website and on YouTube. And remember, please do upvote questions you'd like to hear answered. Those will push them to the top of the list where I'll be looking to choose questions from. Anyway, without further ado, over to Bee for the first presentation.
Thanks, David, and good morning, everyone. So I'll be presenting some of the overall findings on the Scottish finances from our second annual Scottish Budget report. I'll start off by thinking about some of the implications of the 2024-25 budget itself, so thinking about tax decisions, overall funding and spending plans. And then we can look to the medium-term outlook, so some of the risks and trade-offs that will be involved there. So we'll start by thinking about the revenue side of the coming year's budget. So as was expected, the budget announced an increase in income tax on high-income Scots and confirmed a freeze in council tax bills. In terms of income tax, there were two specific changes introduced. So first, a new tax rate of 45p for those earning between £75,000 and £125,000. And second, an increase in the top rate of tax for those earning above £125,000 from 47% to 48%. And this increase in income tax for higher income Scots continues in a pattern of higher income tax bills for this group compared to the rest of the UK. And to illustrate this, I'll show you what income tax bills look like in Scotland compared to the rest of the UK by someone's annual income. And first, you can see that this year, higher income Scots will pay considerably more income tax than they would have in the rest of the UK. But we can look now at the changes introduced in the budget. And here you can see the two changes I mentioned. So first of all, there's the new tax rate on incomes of between £75,000 and £125,000. And then there's the increase in the top rate of tax to 48%. And these changes only apply to a small section of the Scottish population. So only 5% of Scottish taxpayers actually earn above £75,000, so will be affected by these changes to income tax policy. But while they only apply to a small section of the Scottish population, they relate to really considerable tax bills. So to take one illustrative number, someone earning £125,000 will this year pay around £3,400 more in income tax than their equivalent in the rest of the UK. But from next April, from April, someone earning £125,000 will pay more like £5,200 more than their equivalent in the rest of the UK. So this is a really considerable difference, despite the fact that this only applies to a small section of taxpayers. And we can think about how these changes to income tax, combined with other tax policy changes introduced or confirmed in the budget, affect households across the income distribution. And to get a sense of this, we can show you a kind of classic decile chart where we rank households from lowest income to highest income, split them into 10 groups, and show you the average financial effect of these changes on their incomes. And to start off with, illustrating the effects of the changes to income tax we've discussed, you can see that only households broadly in the top 10% of the income distribution are significantly affected by the higher top rates of tax. And we can illustrate changes to council tax that I described, so the freezes to council tax in the same graph. And as you can see, this will benefit households broadly across the income distribution, although will benefit richer households by more. And the combined effect of these two changes is to reduce tax bills slightly for lower and middle income households and increase them for richer households. And the government also confirmed a freeze in the higher rate tax thresholds. And as you can see, this affects a wide section of the top half of the income distribution. And overall, you can see that the effects of these tax policy changes is broadly progressive, with households at the top of the income distribution seeing their tax bills increased, and households at the bottom of the income distribution seeing their tax bills reduced. So much for the revenue side of the budget. Now turning to the funding situation. Funding next year is higher in cash terms than was previously expected, and that's primarily because of two factors. It's a result of better than expected performance from devolved taxes, in particular income tax, and it's a result of some top-ups from the UK government. However, as a result of higher than expected inflation, the real terms value of funding next year is very similar to previous expectations. So to get a sense of this, we can look at how the cash terms and real terms value of funding next year expected in the budget compares to these previous expectations. So the cash terms value of funding next year is much higher than it was expected to be back in the May 2022 resource spending review, which set out expected funding for 24-25. It's set to be around 6.7% higher in cash terms. As I mentioned, that's largely a result of these two factors: better than expected income tax performance and top-ups from the UK government. But there's also been higher than expected inflation in this period, meaning that the real terms value of funding is much more similar. Funding set to be just 0.7% higher in real terms than was expected back in May 2022. And actually, since December 2022, while the expected cash terms value of funding next year has risen, the real terms value of funding is in fact slightly lower, again reflecting this higher than expected inflation. And thinking finally about the change in funding between years, various different estimates are kind of available depending precisely on the comparison point chosen. So according to budget documents published by the Scottish Government, there's a 2.2% real terms increase in funding available for public services this year. But this figure ignores top-ups that were announced and allocated during the year, in particular for health, justice, and local government. And when we compare funding next year to the latest position for this year, so taking account of those top-ups, it in fact looks like there'll be a 0.6% real terms cut in funding available. And as David mentioned in his opening remarks, Of course, it's true that there may be top-ups, but these haven't yet been confirmed, and it's illustrative to look at the change compared to the latest position to see where those top-ups might be necessary, among other things. And funding for the NHS is a particular example of why it's important to choose your comparison point carefully, as well as obviously an important area of spending in its own right. And this is currently set to fall, comparing funding expected next year to the latest position for this year. So to get a sense of this, I'll show you the real terms change that's expected using various different comparison points. We can start off by the comparison that was set out in the budget, so using Scottish Government documents. And these documents imply a 1.3% real terms increase in NHS funding, comparing the two budget documents. And we think actually, when you make a technical adjustment to make the two figures more comparable, on a budget-to-budget basis, it's actually more like a 2.6% real terms increase. But really importantly, this budget-to-budget comparison ignores a big in-year top-up that was announced and allocated to the NHS for £605 million this financial year since the original budget was set out. And when we account for this, it looks instead like the NHS budget is facing a 0.7% real terms fall. And it seems really likely that top-ups will be necessary here. I should say that English health spending is also set to fall on current plans. And of course, it's entirely possible that English health spending will be topped up. This will result in more money for Scotland that can then be used to top up the Scottish health budget. And we should say that the Welsh Government has in fact taken a different approach, so budgeted arguably more realistic increases to the health budget, but funded these through big cuts to other services. And it will be interesting over the next year to see where the challenges emerge in these two different approaches, and which helps different public services address the uncertainty better. And finally, the local government budget is another area where the choice of comparison point really makes a difference. This is another area, like the NHS, that will face significant pressure. And budget figures suggest that local government will receive a real terms increase of over 6%. But when we account for in-year top-ups that the local government budget received, along with a number of other factors, we think it's less than 2% in real terms. So this will be painful for councils. So moving on now to the medium-term outlook. Under current forecasts, the funding available for public services is set to grow by an average of 1% a year in real terms over the forecast horizon. This is, of course, better than real terms cuts, but will nonetheless be very tight. And it's largely a result of very constrained UK government funding, with some further improvements in devolved tax revenues set to boost funding a bit. And to get a sense of how this looks over time, I'll show you the profile of resource funding that's available for public services over the forecast period. And something to note about this profile of resource funding is that it's very front-loaded. So there's a sharp increase of 2.2% in real terms between 24-25 and 25-26. And this sharp increase is largely a result of good in-year income tax performance, combined with a positive reconciliation payment. So this is a result of past underestimates of income tax performance in Scotland. But when we average over the rest of the years considered, there's more like a 0.6% increase on average each year in real terms. And of course, I should note there is lots of uncertainty about this, increasing as we move further away from the current year, both in relation to funding received from the UK government and the performance of devolved taxes. So this all relates to day-to-day funding, but another important area of government spending is investment spending. And capital funding is in fact set to fall under current plans, and this is largely due to a cash freeze in UK funding, as well as a slight reduction in planned Scottish Government borrowing. And capital funding under current forecasts is set to fall by 16% in real terms over the forecast horizon. And again, there are uncertainties here. But despite all these sources of uncertainties, bar a very big upturn in the UK or Scottish economy, some really big tax rises, or some large increases in planned borrowing from the UK government, which would break fiscal rules, there will be tricky trade-offs for the Scottish Government to confront. And to get a sense of these trade-offs, I'll show you the outlook for services under existing funding forecasts under two sets of assumptions. So here, what I'll do is assume that health and local government are protected to some extent. These are two large and important areas of spending where the Scottish Government has made specific spending commitments, and we expect there to be quite a bit of upwards pressure. And we can look at what protection for these two services means for all other services considered. So first, in our slightly less generous scenario, we'll assume that health gets 2.3% real terms increases each year, The Scottish Government has previously described this as a minimum amount necessary for health spending needs. We'll also assume that local government budgets are held flat in real terms, leaving them to rely on council tax for any real terms increases. And when we assume these two things, this implies a slight real terms cut to funding for all other services over the 4 years to 28-29. We can instead assume slightly more generous protection for health and local government. So if we assume 3.3% growth in the health budget each year, which is more in line with what Scotland might need to follow the English NHS's long-term staff plan, and if we assume that local government receives 1% real terms increases, this implies more like 12% real terms cuts for other services over the forecast horizon. So the outlook is pretty tight and difficult choices will need to be made. And just to finish off, I want to highlight two kind of significant sources of uncertainty here. And the first relates to UK government funding, and this could be described as a kind of upside risk. So currently, planned UK resource and capital spending over the forecast period is very tight. Spending hasn't yet been allocated to particular departments. That's set to happen in a spending review that's scheduled for some point this year. And this means that the implied cuts to various specific areas of funding remain quite vague. When the allocation is made in the spending review and the cuts are forced to be made explicit, it's likely that there may need to be top-ups to various services. Spending reviews are historically points where planned spending envelopes are topped up as the government confronts having to lay out cuts more obviously. So one upside risk that we think there is for Scottish funding in the future is more UK government funding than is currently forecast as a result of these top-ups to spending envelopes. And the second source of uncertainty is related to devolved net tax revenues, in particular income tax. So we think, and the Scottish Fiscal Commission thinks, that it's more likely that net tax revenues will be lower rather than higher. And this could leave other services in a more difficult situation by meaning that funding available is lower. And we can look at what either of these two scenarios, the upside scenario and downside scenario, imply for funding, again, using our less generous and more generous protection assumptions for health and local governments. So when UK funding is higher than currently budgeted as a result of a top-up in the coming spending review, the situation is considerably eased. So in our less generous scenario for protection for health and local government, you can see that the real terms increase in funding for other services is around 7.5%. And even when we assume more generous protection for health and local government, funding for other services falls by around 4% in real terms over the forecast period. So still a tight outlook, but definitely easing some of the choices that will need to be made. But in the downside scenario, things look really difficult and really hard choices are going to have to be made for funding for other services. So as you can see, even with our less generous assumptions for protection for health and local government, the implied change in funding for other services is around a fall of 9% in real terms. And under our more generous scenario, it looks like funding for other services will fall by more than 20% in real terms over the forecast period if income tax revenues turn out to be lower than expected. Okay, so to summarise, we've seen that there have been further significant tax rises on the top 5% of Scottish taxpayers announced in this year's budget. And as we've seen, this continues in a pattern of relatively progressive revenue raising. We've seen that funding next year is much higher in cash terms than was previously expected as a result of better than expected devolved tax performance, as well as top-ups from the UK government. But we've also seen that the effect of higher than expected inflation has been to erode nearly all of this in real terms. As we've seen, public service spending is currently planned to be lower in real terms next year than this, including for health, and that's the case when we compare plans for next year to the latest position for this year. And it seems likely that without some top-ups, there will need to be either job cuts or worsening of public services. And as I've just shown you, Scotland faces some really tough choices for public services in the medium term, and that remains the case even if there is some extra UK government funding. There is significant uncertainty around all of this, and it will be important that devolved taxes remain performing as well as is currently forecast to avoid really tough choices from needing to be made. That's all from me, and now I'll pass over to Max to talk in more detail about health.
Thank you, Bee. So as Bee just said, I'm now going to talk in a bit more detail about healthcare spending, staffing and activity in Scotland. So health has been devolved to the Scottish Government since 1999, which means the Scottish Government has discretion both over the funding of the NHS and healthcare, but also its organisation. And that means there are some differences from the NHS in England, Wales and Northern Ireland. At the same time, health is the largest single area of Scottish Government spending. So under the current budget for next year, over a third of the Scottish Government's total discretionary budget will go towards healthcare. And that share of funding going towards healthcare has both grown over time and is projected by the Scottish Fiscal Commission to keep growing over time, both given demographic pressures, but also given rising health costs that we tend to see over time. So in this presentation, I'm going to cover two main things. I'm first going to look at health spending in Scotland and then look at how that compares to England and Wales. I'm then going to look in more detail at NHS staffing and activity in Scotland since the start of the pandemic. Okay, so starting first with health spending. This chart on the left-hand side shows real spending per person on healthcare in Scotland since 1999. Most of this goes towards the NHS, but it also includes a few other areas of healthcare like vaccinations and public health. And the first thing that's clear in the chart is that health spending per person has risen a lot in real terms over time. So in last year's prices, health spending rose from about £1,700 per person in 1999 to about £2,800 in 2019-20 on the eve of the pandemic. That's around a 70% real increase over this period in per person spending. And although health spending rose during this period, that didn't happen evenly. As you can see in the chart, in the first decade of the 2000s, health spending per person grew much faster in real terms, at an average rate of 5% per year, than in the 2010s, when it grew much slower at 0.4% per year, and indeed in some years fell in real terms year on year. That reflects the overall funding envelope available to the Scottish Government in the 2010s, and if you looked at England, you'd see a similar slowing down in health spending. Health spending, of course, rose a lot during the pandemic, and although it started to come down quite a lot, in the latest data we have, which is for last year, health spending per person was still 10% higher in real terms than pre-pandemic in 2019-20. And as Bee mentioned in her presentation, under current budgets, we expect the total health budget to fall slightly in real terms between this year and next, and indeed that will also happen per person. Okay, so that's what's happened in Scotland. I'm now going to compare what that looks like relative to England and Wales. So this chart again goes from 1999 to 24-25, but instead what I've done is plotted in yellow Scottish health spending per person relative to England, and in red, Scotland relative to Wales. So here a positive number means that Scotland is spending more than the other nation, a negative number means Scotland is spending less per person. At the dawn of devolution in 1999, Scotland spent a lot more per person on health than either England or Wales. So it spent about 22% more than England and 9% more than Wales. But there's been a very clear trend in this chart. This gap has declined over time. And that's because even though Scottish health spending has grown over time, spending in England and Wales have grown faster. And this in part has allowed Scotland to spend more on other areas like education. Under current budget plans of all of these nations, we think Scotland will spend about 3% more than England in 24-25, so next year, and 10% less than Wales per person in 24-25. And you can see even pre-pandemic, it started to be the case that Wales was spending a little bit more than Scotland per person. Okay, so that's what's happened to health funding. We're now going to zoom in a little bit and look at what's happened to NHS staffing and activity in Scotland since the start of the pandemic. And in particular, on this chart, I'm going to plot what happened to both staffing and activity in the first half of last year, as this is the latest data for some of these things, relative to the same period in 2019, pre-pandemic. And as I said when we talked about funding, health spending is about 10% higher last year in real terms than pre-pandemic. And so perhaps unsurprisingly, we see that staffing has also increased a lot. So the NHS in Scotland has about 11% more consultants than pre-pandemic. In 2023, it had about 14% more junior doctors and 8% more nurses. So there's more staffing and there's more funding. However, if we look at activity, and by that I mean the number of patients being treated by hospitals, is below pre-pandemic levels. So elective admissions, for example, were 11% below their pre-pandemic level, emergency admissions 8% below, outpatient appointments 6% below. So this fall in activity is really quite concerning for two main reasons. Lower hospital activity, one, means that waiting lists are likely to keep rising. If anything, we probably imagine demand has slightly increased for care relative to pre-pandemic. So while hospitals are treating fewer patients, the waiting list is likely to keep rising. But more generally, lower hospital activity, when combined with the fact that both funding and staffing are higher than pre-pandemic, points to a substantial fall in measured hospital productivity. And by that I mean hospitals are treating fewer patients given their resources, in particular their funding and their staffing. Importantly, as we're going to see on the next slide, that fall in hospital productivity in Scotland is very similar to the fall we see in England. But as we'll see, England has increased staffing by more than Scotland since the start of the pandemic, and hospital activity has also recovered by more in England. So I'm going to start with the exact same chart we had previously with Scotland in green, but then I'm going to add in England in yellow. And as I just said, you can see in England on the left-hand side, staffing has increased by more than in Scotland. So for example, the English NHS has 15% more nurses in this period relative to pre-pandemic, while the Scottish NHS had 8% more. And on the right-hand side, you can see that activity has also recovered somewhat more in England. Taking the most extreme example, if we look at outpatient appointments, over this period, Scotland delivered 6% fewer than pre-pandemic, while England delivered 4% more. It's not only activity that's different between these two nations. In both England and Scotland, measures of performance, and I mean things like waiting lists and waiting times, have also worsened a lot since the start of the pandemic. But here there's less of a clear comparison between the two countries. When it comes to activity, England has recovered by more than Scotland. But then when we think about performance, for example, A&E waiting times tend to be better in Scotland at the moment than in England, but the elective waiting list has grown by more in Scotland than in England. So it's a bit more of a mixed picture when it comes to performance. Okay, so circling back to this lower measured hospital productivity, this is a really striking change. There's more staff, there's more funding, but fewer patients being treated in 2023. So what could explain this? Well, one explanation is that although staffing has increased, other important inputs may not have increased by so much. And the clearest example is that in Scotland, staffing is substantially higher than pre-pandemic, but there are actually fewer hospital beds than there were in 2019. And so this may be reducing how many patients can be treated. There are still COVID-19 patients in hospital that may reduce productivity. And more generally, we might think that patients could be sicker than pre-pandemic. So if patients are sicker when they arrive at hospital, to treat the same number of people, you may need more resources, there may need to be more treatment. Finally, we may think that there are management issues and particularly bottlenecks in the system stopping patient flow. And a really well-known example of this are delayed discharges. This occurs when a patient is ready medically to be discharged from hospital, but they can't be. And so that bed is occupied by the patient rather than any new patients. And delayed discharges are much higher in Scotland than they were pre-pandemic, potentially reducing how many patients can be treated. In practice, it's likely a mix of all of these explanations. And remember, a similar fall has happened in both England and Scotland, so it's unlikely to be a very specific factor to one of these countries. But the importance of each of these factors remains unknown. But the risk of lower measured hospital productivity is that increasing spending on the NHS will not improve performance as much as it would have pre-pandemic. Or another way to see this is if we want to get performance back to pre-pandemic levels, we're going to have to spend more than we did pre-pandemic. And therefore, we really view that increasing productivity in the NHS and actually just a better understanding of it should be a major focus for the Scottish Government. Okay, so to wrap up and think a little bit about the future outlook, I showed at the beginning, Scottish health spending has grown over time, but English and Welsh health spending has grown even faster. And so Scotland spends less relative to these countries than it did at the dawn of devolution. As Bee mentioned as well, Scottish health spending on current plans is set to fall in real terms next year, but may well and is maybe even likely to be topped up, as often is the case. And it's not only funding that's different between the different nations of the UK. One striking difference is the outlook for the size of the NHS in the future. So the Scottish Government in 2022 published a health and social care workforce plan, and that implied that the NHS workforce in Scotland would grow by 1% between 2022 and 2027. England last year published a similar plan, but that plan outlined a 20 to 21% increase in NHS staffing over the same period. So there's a really striking difference in the plans for the size of the future NHS workforce. Though, of course, what actually happens may differ somewhat from these plans. In terms of productivity, we've seen that both in England and in Scotland, there's been a large and persistent fall in hospital productivity. And this is really a major concern. Lower productivity is bad for everyone. It's bad for staff, it's bad for people who are unwell and need treatment, and it's bad for taxpayers, because it means more resources may be required to deliver the same service. And that's particularly challenging given the difficult fiscal situation Bee outlined. Increasing health spending by more is going to require really difficult trade-offs elsewhere for the Scottish Government. Okay, that is everything from me. Thank you for listening. I'm now going to hand over to my colleague Kate Ogden, who's going to talk more about higher education in Scotland.
Great, thanks, Max. Yes, so as Max mentioned, I'm going to talk about higher education spending in Scotland. Yes, there we go. It's interesting partly because the Scottish Government has made very different choices to governments in the rest of the UK about how higher education for Scottish students should be funded, and particularly how the costs of that should be shared between graduates and taxpayers. So the Scottish, around £1.4 billion is spent each year on Scottish undergraduates, and I'm going to focus purely on undergraduates today. Around £0.9 billion of that is spent on actually teaching those students. So for students who stay and study in Scotland, the Scottish Government funds universities through a teaching grant, and there's also a notional tuition fee, which I'll come back to later, but this is paid on behalf of students by the Scottish Government. So from the student perspective, tuition is free. Around £0.6 billion is spent each year on living cost support, so supporting students with the costs of their cost of living while they're studying. Most of this is provided in the form of loans, which are then repaid by graduates once they're earning above a specific threshold. Some of this support in Scotland is provided in the form of grants. So in this presentation, I will quickly outline what's happened to living cost support over the past decade, and where there have been some big changes this year and next. And I'll also mention some changes in loan repayment terms, which will be important for graduates. I'll then talk about university funding, and here the picture is one of a continued squeeze on resources for universities. And then I'll mention how this factors into the Scottish budget and some potential options that the Scottish Government has going forwards. So first, living cost support. And I'm showing you here real-term support for young Scottish students with low household income. And the amount that those students are entitled to has been gradually eroded by inflation over the past decade. So between 2013 and 2022, there was effectively a cut of £1,600 per year in real terms in what support students could get towards their living costs. This academic year, students were allowed to borrow £900 more than last year, and this was the first real terms increase in a decade. But planned for next academic year, so from this autumn, all Scottish students will be entitled to borrow £2,400 more towards their living cost that academic year. So this is a huge increase. For the poorest students, it's around a 24% increase in their entitlement to support. And importantly, this delivers on a Scottish Government commitment that was made in 2020 to provide support equivalent to the living wage by next academic year. To show you what this looks like across the household income distribution, so here I'm going to show you what support young students in Scotland would be entitled to depending on their household income. All Scottish students, young students are entitled to borrow either £8,400 or £9,400 next year. In addition, those with low household incomes are entitled to these extra grants, which they don't have to repay. You can see this slightly strange feature of the way this system is set up has these cliff edges. So if your household income is just under £34,000, you're entitled to £1,500 more support than if your household income goes just above that level. To compare this to some of the rest of the UK, this is what the schedule of support looks like in England. So in England, it's all provided in the form of a loan, but it's gradually tapered away with income, so you don't have these same cliff edges. But the poorest students in Scotland next academic year will be entitled to a bit more than they would be if they were English domiciled students. In contrast, Wales has quite a different system. It provides the same total amount of support to all students, regardless of income. It just provides a different share as loan or grant, depending on household income. So this is what the picture looks like. I've mentioned that students borrow towards the living costs, they take out loans. They then repay those loans at 9% of earnings above a particular earnings threshold. From April 2024, the threshold above which Scottish graduates make repayments will increase from £27,660 to £31,395. Now, what this means is that Scottish graduates will be able to earn more before they start making loan repayments. And many, so anybody earning over that new high threshold, will repay £336 less per year or £28 less per month than if this threshold hadn't increased. And interestingly, this compares to a continued freeze in the earnings threshold in England and Wales. So what do all these changes mean for Scottish students and graduates? Here I'm going to show you expected lifetime loan repayments for Scottish graduates, accounting for inflation, and I'm arranging people by decile of lifetime earnings, so those who earn least over their lifetimes on the left and the most on the right-hand side. Under the current system for 2023, so if there hadn't been any changes, this is how much we'd expect graduates to go on to repay over their lifetimes. The increase in the repayment threshold does very little for those in the top half of the income distribution. It reduces their monthly repayments, but we still expect the vast majority of those graduates to repay in full over their lifetimes. They just repay less each month, but for more years. It does make some difference over their lifetimes to those at the bottom end of the lifetime earnings distribution. Then the increase in the living cost loans, if all students took out the bigger loans they're entitled to, would increase repayments. In particular, we expect those in the top half of the graduate earnings distribution would take out the extra loan. If they take out the extra loan, we expect them to repay that extra loan. And if we look then at what net difference this makes to people over their lifetimes, taking into account the fact that they're getting extra support, we can see the various changes planned for 2024 will benefit the lowest tenth of earners by around £9,000. That's because these students, if they take the extra support that they're entitled to, we don't expect them to fully repay it. So for those graduates that go on to not earn as much as others, this will particularly benefit for those graduates. So I've talked about living cost support, turning now to funding for teaching, so funding that goes to universities to actually deliver teaching to students. Here we've seen funding in real terms be eroded over time. That's because that tuition fee element has been frozen and the main teaching grant hasn't increased as quickly as inflation. So universities in Scotland will receive around £7,500 per student. This academic year for teaching each Scottish undergraduate. That's around a 19% cut compared to what they would have received in 2013. And to compare this to England, it's around 21% less per year of study than an English university receives for teaching an English undergraduate. Another key difference is that there are caps on the number of places at Scottish universities for Scottish students, in effect, and that has helped the Scottish Government to control the costs of its commitment to free tuition. And together, these things mean that Scottish universities are increasingly reliant on fees paid by international students, which are higher than the fees than the funding that they get for a Scottish student typically, and there aren't caps on the numbers of international students. So these fees now make up around 30% of the income of Scottish universities on average. That's a little bit higher than in England, but we've seen a similar trend in England as well. How does all of this factor into the Scottish budget? Well, importantly, increases in generosity for students and graduates that come through the loan system won't actually cost the Scottish Government a penny. And that's because the UK Government currently funds the issue of loans to Scottish students, and it funds the cost of any loans that are eventually written off, so anything that doesn't get repaid in the end. And it does that on the basis, it will continue to do that if the costs of this system in Scotland are broadly comparable to costs of arrangements in England. It's not totally clear how that comparability is assessed or exactly what metric is used. So it's hard to say what changes might affect this arrangement. But at the moment, the plan changes to living cost support and to loan repayments next year won't appear in the Scottish Government budget and be traded off against other priorities. In contrast, free tuition means that the teaching costs for Scottish undergraduates staying in Scotland are all met by the Scottish Government and are traded off against other priorities of the budget. So looking at the 2024-25 budget, the line that funds the main teaching grant, which is higher education resource spending, is being cut in cash terms by 6% if you compare the 23-24 and 24-25 budgets. Now, actually, this spending line was cut in year. So since the 23-24 budget was set out, there have been cuts made in year to that. And so if you compare the latest position for 23-24 to the 24-25 budget, it's a 3.6% cash terms cut. And what this is likely to mean is both a continued squeeze in real terms on per student funding that universities receive, and also cuts to the number of places for Scottish students. So finally, I'm going to show you some estimates of where the long run costs of higher education will lie. So taking into account cash spending up front by the Scottish Government, and then the issue of loans and the proportion of those that's likely to be repaid. So looking just at the current 2023 system, so if there hadn't been any changes, we'd expect the Scottish Government to spend around £1 billion on the cohort starting in 2023. That's a mixture of their teaching and also any grants for living costs. Graduates, Scottish graduates, we would expect to repay around £1.2 billion, sorry. This is the repayment of living cost loans, and then the UK Government will eventually meet the cost of any loan write-offs. Turning to 2024, we can see the biggest change here is an increase in loan repayments and in loan write-offs. That's because of the additional living cost support provided in the form of loans. Around half or a third of that will be additional write-offs, and around 2/3 we expect graduates to repay. Now, I've mentioned that university funding has been continually squeezed, so one thing the Scottish Government might want to do would be to find somewhere some more funding for universities. One thing it could do would be to increase the tuition fee, that notional tuition fee paid on students' behalf, from £1,800 to £4,000 per year. This would increase resources for universities by around 30% and take them back to the same real-term position as they were in around 2013. If they did this just through increasing this tuition fee, but the Scottish Government continued to pay that, then all of this extra spending, around £250 million per cohort, would go into sort of Scottish Government budget resource spending here. As an alternative, the Scottish Government could look to make that tuition fee payable by Scottish students. This would deliver the same increase in teaching resources, but would share the cost differently. So the Scottish Government would actually find itself spending less upfront, and graduates would end up repaying more. There'd also be extra loan write-offs met by the UK Government. Just as an interesting comparison, and one that's relevant if we're thinking about that broadly comparable costs condition under which the UK Government continues to fund these loans, we've also modelled what the cost would look like if the Scottish Government were to implement the same arrangements as in England, but retained the typical degree length in Scotland, which is 4 years rather than 3 in England. In this case, we'd see significant loan write-offs by the UK government, larger than under the current system, but Scottish graduates would have to meet much more of the cost. But this would save the Scottish Government considerable amounts, around £29,000 per student. So just to summarise briefly, living cost support for Scottish students will increase substantially next academic year, but funding for teaching those students faces a continued squeeze. The free tuition policy in Scotland means that any increase in university funding requires money to be moved away from other areas of the budget to deprioritise other areas of spend. This is particularly difficult in the current, given the current fiscal situation that Bee outlined. Introducing tuition fees would cost Scottish graduates much more in higher loan repayments. If the Scottish Government tried to protect Scottish graduates from those loan repayments, it would have to increase loan write-offs, and that presents a risk to the current funding arrangement under which the UK Government meets the costs of loans. If you're interested in looking at other options, we have also, alongside the report, published a calculator which allows you to tweak all sorts of parameters of the student finance and funding system and see what happens. So yeah, go and have a play with that. But I'm going to stop sharing now. That's all from me, and I think we've got time for Q&A.
Thanks, Kate. Thanks, Max. Thanks, Bea. I think that was really, really interesting. And I think we've got lots of questions on Slido. So I'm going to look through them now just quickly and select a couple. So why don't we kick off with one? Maybe Bea can have a kind of first look at this question. So there's a couple of questions asking about the behavioural responses to income tax. So there was an income tax increase announced for the coming year's budget. How large do we think those behavioural responses might be? How much is that affecting revenues? Will it affect people's behaviour? Will it if impacts on employers and so on? Bea, I don't know if you wanted to say anything about what the Scottish Fiscal Commission is assuming about behavioural responses, and perhaps I can then come in a little bit as well.
Sure. Yeah, I mean, it's a good question. The Scottish Fiscal Commission is assuming really significant behavioural responses to these increases in income tax for the highest income Scots. So kind of a combination of changes in labour supply, changes in migration and tax avoidance and evasion behaviour are all kind of set to reduce the revenue from both of the changes introduced, but in particular the increase in the top rate of income tax. So for those earning above £125,000, the SFC assume that that will reduce the revenue from the increase in the top rate by around 85%. And one kind of figure to draw out, I think, is that if there are no behavioural responses to the changes introduced, it's estimated that the two changes would raise about £200 million next year. But instead, the forecast post-accounting for these behavioural responses is more like £82 million. So really kind of considerable behavioural effects there, pushing down revenues that they expect.
Yes.
I don't know if you wanted to say anything else on that, David.
I think what I'd say is there's quite a bit of uncertainty around this as well. So Bea is right there. The SFC has taken some sort of central assumptions about the degree of responsiveness of different taxpayers, and the evidence is that the very richest taxpayers are more responsive because they have more scope to avoid taxes, whether that's through sort of, planning their tax affairs, potentially converting into companies and taking it as dividends, which don't take the Scottish tax, or actually might be more worthwhile for them to make the decision to migrate. There's relatively limited evidence so far on just how big these responses are in the Scottish context. HMRC and the Scottish Government did a joint study which looked at the impacts of the initial changes to the taxes back in 2018, 2019, but obviously they were much smaller than the changes we're now seeing. And one of the challenges, of course, is that it takes quite a bit of time for the data to come through. So tax changes that will take effect in April, the data to sort of analyse the impacts of those on taxpayers' behaviour, the tax records, aren't really able to analyse until the summer or autumn of 2026. And you've got 2 further budgets in the meantime. So I think one thing the Scottish government, might be considering is sort of, how can we look at, doing some more analysis before making further decisions, but also, can we get information, from other sources, not just looking at tax records? Can we track other information about how this is affecting behaviour? But yeah, as Bee says, sorts of changes at the top, we would expect behaviour responses. That would include tax avoidance, changes in labour supply, migration, not just people moving away from Scotland, but potentially fewer people moving to Scotland. But, potentially quite large, although lots of uncertainty around there. So, yes. The next question, maybe Max can have a go at this one first. It's got the most votes. A lot of money is being spent on setting up a national care service in Scotland. Will this help ease pressure on the NHS, or is it taking money off it?
It's a good question, and I'm going to I think there are two parts to this question. Will improvements in social care, like a national care service where the government is providing more social care, ease pressure off the NHS? I think the available evidence is yes, but a bit. I would summarize. It's the case that things like delayed discharges may be improved if there's better social care precision. It's also the case that it may reduce, for example, elderly people coming to A&E when they don't need to. So it's definitely the case that improvements in social care could benefit the NHS, but I wouldn't sell them as necessarily being huge improvements. I certainly wouldn't sell it as being kind of paying for itself improvements. I think improvements in social care or an increased provision, because ultimately what Scotland is doing is providing a more public services than is happening in England. So with social care in Scotland, free for adults and elderly people now. In England, it's means tested, and say half of people are getting state support, half of people are paying privately. That is, in a sense, an expansion of the role of the state. That, of course, will cost money, and I think should be really motivated as the reasons you want to do that are improving or expanding this service provision. You might think that people paying out of pocket, when it says under provision of social care, you may be worried about the inequality angles of that. It will potentially benefit the NHS. I don't view it. It's not likely to have a huge benefit, but there are certainly spillovers between the two sectors. In terms of funding, well, of course, the Scottish Government has an overall funding envelope. And crudely, once that funding, holding that funding constant, spending more on anything is going to reduce what's left for other things. And B showed that quite clearly. So there certainly is a trade-off, but of course, that funding envelope can be changed as well.
Yes, thanks, Max. I completely agree. And I think it's also kind of worth noting that the sort of national care service is a slightly different beast to what was initially planned. The Scottish Government, I think, was initially planning to set up sort of new regional sort of bodies to control social care. It would no longer be a local government responsibility. It's now more a bit like a national brand with some sort of higher conditions for staff pay and training. And exactly how and when it will roll out is a little bit uncertain. But as Max says, I think, there is evidence that improvements in social care services and access to social care does actually reduce some demand in the NHS, but not to the extent to sort of pay for itself, if you like. So you need to sort of make a case that this is a good thing to do unto itself. And, I think you can make that case, if you think that kind of social care and, sort of quality of life that can bring is very important. But yeah, no, completely agree with Max there. The next questions. Okay, so the next couple are also sort of for potentially B. So if the Scottish Government wanted to at least maintain the level of spending on services, i.e. avoid the cuts implied in these presentations through raising yet more revenue, does it have any realistic options to do so under current powers? So those 0.6% cut in real terms in the current financial year, is it realistic that revenue raising could address that?
So I guess I'd say it's probably going to be relatively difficult, especially when we're thinking about the medium-term forecasts as well, given the kind of scale of the changes and cuts we're talking about. It's true that, only some taxes are devolved to Scotland, and as we've kind of just discussed in terms of the behavioural responses to income tax changes, some changes changes to devolved taxes, while they can boost revenues to some extent, are quite unlikely to be able to do so on the scale required to avoid cuts. And there are some borrowing powers available to the Scottish Government, but those are relatively limited. And I guess I might say that's perhaps especially hard in the medium run, given some choices that the Scottish Government has made about social security spending, which is broadly more generous than in England and kind of further squeezes the amount that's available for public services. I don't know if you had any kind of further thoughts on that, David.
Yeah, so I completely agree. In the medium term, it would be, that spending is going up in the medium term, but probably not enough to keep pace with rising costs and rising demands. As Bee said, it's about 1% a year on average in real terms. I think when the Scottish Fiscal Commission looked at sort of what the long run increases required across public services in Scotland, it's sort of a more like 2% in real terms a year. That difference between 1% and 2%, if you add it up over 4 years, that's about probably pushing 1.6, 1.7 billion pounds. You'd need about a penny on all of the rates of Scottish income tax to raise that sort of money. So it's quite substantial tax increases if you wanted to do that. And as Bee said, you then might, again, particularly for those higher earners, sort of start to see behaviour responses. In the short term, that 0.6% cut in real terms, that sort of figure, there would have been options available to the Scottish Government if it wanted to sort of raise equivalent revenues for that. So, for example, the council tax freeze, 144 million, that's equivalent to, I think, about a 0.4% on the Scottish budget, 0.3, 0.4. So that would get you some of the way, for example. But yes, there clearly are decisions around tax, different decisions the Scottish Government could have made on tax. In the short term, that could have, possible to sort of, avoid the kind of short-term cuts. But over the long term, you need to make really quite substantial changes, as Bee said. And the other thing I'd say is that, and there's another question, maybe I can kind of address this one at the same time, talking about kind of broadening tax bases and so on. I'll address part of it. I'll come back to the other part maybe a bit later. Scottish Government has, so far at least, when it's looking to raise revenues and particularly to increase the progressivity of its tax system, has focused very much on income tax. And Scottish Government, whilst its powers are sort of, over just a few taxes, it does also have pretty sort of significant powers over property taxation. So it's got business rates, it's got council tax, and it's got the land and building transactions tax. And I think that there is scope for the Scottish Government to think not just about these on a tax by tax basis, but think actually how do we set income tax policy and these property tax policies to raise the revenues we think we need and redistribute as much as we want, but in the most efficient ways. And I think there certainly are ways you can make those taxes together fairer and more efficient, and if you wanted to, more progressive as well. So there are options there, definitely. Great. So the next question, actually, I'll give one for Kate. There are two around higher education that have been upvoted. So one is with the new policy supporting students in Scotland, how big is the difference between what the Scottish Government is investing per head on higher education compared to England? And also, do we have any evidence about Scottish higher education students' performance compared to England? I think the answer probably there is I'm not sure. But Kate.
Yeah, the answer on performance from me, I think, is no. I don't have anything particularly to say on that. I think if we do more work on higher education in Scotland, it's one of the things on the long list to take more of a look at. On investment per head, that really depends how you think of what do you mean by investment per head. So I mentioned that teaching per year of study, funding for teaching per year of study is lower in Scotland. But given the longer degree length, actually, it's around £30,000 per student on average over the whole course of the degree in both England and Scotland. So teaching, it depends how many years of study you're comparing. Given the changes to student support, the total kind of average support students will get will be more similar now between England and Scotland. I think one way to think about this in the long run is to look at so that comparison of what the Scottish government would spend if it implemented the English system in its entirety, but kept the 4-year degrees. In that case, the Scottish government would spend around £850 million less per cohort. So it would spend a lot less if it switched to the English system. The benefits of that would be shared between the cost of that would be shared between Scottish graduates, who would then repay significantly more, and the UK government, who would write off significantly more in higher loans. So that was a complicated question. Some of the gains of the free tuition policy, most of the gains go to Scottish graduates, some of them go to the UK government. Overall, I'd suggest reading page 23 of the report of the higher education chapter, because that's explained it much better than I just have.
I think that was really quite clear, Kate. I think there was a number in the press release, wasn't there, that sort of said, have you got those numbers to hand?
I
So,
do.
like, how
so
much per student?
So there's, compared to the English system, the Scottish government spends around £29,000 more per student in the long run than if it switched to the English system. Around £24,000 of that benefits graduates, either through them getting more spent on them and then also them repaying less. Around £5,000 of that benefits the UK government in the form of lower loan write-offs.
Great, thanks, Kate. And yes, I think on the higher education performance, that is, I think, difficult not just to do within between Scotland and England. Actually, within England, within Scotland, you can perhaps sort of track graduate earnings and employment opportunities, but actually and there are surveys of teaching quality and so on, but it's not quite as easy to do as it is for schools, for example. And I think it also kind of there is comparable issues between countries, and those have been growing over time. It's not just with higher education, but with school education, with health service, with social care. The way things are measured are sometimes just slightly different in different countries, and it does make comparisons difficult. Now, it can make sense to measure things differently if your system's trying to do different things. But I think one of the things I know the ONS is trying to think about is, can it kind of encourage, sort of more comparability of some key sort of performance measures, so there can be more benchmarking across the UK as a whole, because benchmarking is one way you can kind of, learn as a service provider and as a government, but it's also a way that people can hold governments to account as well. So it's a particular issue in higher education, but that is an issue, I think, more generally for a lot of public services now across the UK, where opportunities for learning and sort of holding governments to account are not as good as they could be because of just differences in measurement and so on. Great. So we've got a couple more questions come through now. So one again, I guess for Bee, the Scottish Government postponed its medium-term spending plans once already, citing uncertainty. It's now due to happen in May. Will the uncertainty really be any less by then?
I think that's an important thing to ask. I mean, as I kind of mentioned in my presentation, we think there's the potential for quite substantial changes in UK government spending plans for 25, 26 and beyond that. And that's the case kind of at the upcoming spending review at some point this year. And also, of course, we've got an upcoming general election, and it's likely that spending plans might be considerably changed at that point as well. So kind of for those reasons, it might make sense to push those plans back again until a kind of spending review and post-election settlement make it clearer what the kind of outlook is for UK government spending in the medium run. And something that we suggest in our report is that it may make sense to align these Scottish spending reviews with UK spending reviews. That's currently the case in Wales and could help Scotland deal with some of this kind of inevitable uncertainty and lessen it to some extent.
Yes, thanks, Bee. No, I agree. I think it's a tricky one because obviously Scottish Public Services want, as much notice as they can, have medium-term plans to help their funding. But if those medium-term plans are sort of, if you like, based on plans at UK level, we think will be changed quite considerably after an election, you know, I think either they need to sort of know those plans, you can't sort of put too much weight on them, or just postpone a while. I think the March budget will be interesting. We've been hearing some rumours, that in order to create more fiscal space for tax cuts, the Chancellor might reduce, that 1% real terms increase per year in funding down to 0.75%. Again, that would be even tighter than what Bee was describing, and therefore, again, might like an even bigger top up sort of post-election to those sorts of plans. So I'd suggest that come May, the uncertainty and the kind of potential changes to sort of the medium-term outlook might be even greater than they are now. So it may make sense to kind of push those plans back, or at least make sure that it's really clear there's a lot of uncertainty around them. Max, one for you here. How do planned increases in NHS staff in England and elsewhere feed into funding for medical career training and universities and higher education in general? So, you've got these long-term staffing plans. That's not just about funding, is it? It's also about the availability of staff.
Absolutely. And so I guess starting with Scotland, the workforce plan in Scotland doesn't actually envisage a very large increase in staffing. So in a sense, there may not be large implications for medical training, though there may still be some. As Kate mentioned earlier, medical or all university places in Scotland are subject to kind of a cap, and that's true for medical school places. Actually, there's a similar thing in England too. I think where the training really matters is actually in England, because the workforce plan is so much larger. There are a huge amount of resources and planning is going into doubling the number of medical school places, doubling close enough the number of nursing places at universities to actually try and get this increase in workforce. But because in part the Scottish plan isn't actually envisaging this huge workforce, I think it's much less of an issue in Scotland, though it still does matter. And actually medical school places for a long time were capped and had, in the last 5-10 years have been increased somewhat. And we actually see that flowing through in terms of new doctors. So these things do matter, of course, in Scotland too.
Great, thanks. And I guess there's a sort of a related question here. So do we have anything, do we know why there is this big gap in the workforce plans north and south of the border? Are the plans comparable? Are there some sort of, differences in the kind of types of staff they're talking about? Are they affected by a lower baseline when vacancies are taken into account? Are there, more vacancies in Scotland and therefore they need to fill those first?
Yeah, these are really good questions. I would say starting with comparability, the best we can work out, these are comparable. These are full-time equivalent staff working in the NHS in Scotland, working in the NHS in England. The Scottish plan doesn't actually have very much detail on this in terms of its objectives. So, there's some ambiguity, but as far as we can tell, they are broadly comparable. Why they're so different? Well, I think there's a couple of things. One, I think the lower baseline is an important one. Pre-pandemic, at least, Scotland has more doctors and nurses per person than England. You might think there's potential that actually there's also fewer vacancies in Scotland than in England. In England, there's very well-known major workforce challenges for the NHS. I would say, though, in Scotland, it's also true that things like agency spending on nurses and doctors is actually a lot higher than it was pre-pandemic. So it's not the case that there aren't these challenges in Scotland, but it may be that they were lighter. And so in a sense, England has further to catch up. One other reason that they're so different is demographic pressure. Scotland faces less pressure on its health services from demographics than England does. A lot of that's because the population is essentially going to grow slower in Scotland. And that's something that the Scottish Fiscal Commission have really highlighted, particularly over the medium and long run, that Scotland does face less demographic pressure on the healthcare services than the OBR forecast in England. But then finally, maybe these are also reflecting just different policy decisions made by the two governments. And I really would caveat all of this, but we see, lots of plans can be made, but what actually happens can be quite different from that. I would certainly not be surprised in 5 years' time if Scottish NHS workforce has increased by more than 1% because there have been pressures there, and the English NHS workforce has not increased by 20 to 21%, because that's a really quite large increase.
Great, thanks, Max. We've got a question which maybe I'll have a first stab at here. I'll make it maybe a little bit broader. And it's like, the question is, would the fact that public sector pay in Scotland is higher than England be expected to affect NHS performance? And I think actually it's not just the NHS where pay is higher in Scotland. Also, there have been bigger increases in pay in recent years for teachers in Scotland, and teachers are now paid quite substantially more in Scotland, and that's true, I think, a few other areas as well. Now, you probably would expect that higher pay would lead to better recruitment and better retention of staff. But one thing that is actually a big open question is actually how has these pay policies, how have they changed recruitment and retention in Scotland compared to the rest of the UK? It's not something I've seen any research on at the moment. I think it is an important open question. If you're spending, substantially more money on pay, you want to be able to know whether that is translating through into improvements in sort of productivity, in service quality, and so on. I think in Max's chapter on health, there's a really stark figure about how the pay bill for the NHS in Scotland, Max, you might have the figures to hand.
Yeah, so it went pre-pandemic, like 2019, about 46% of the total NHS funding was going on the pay bill. In the latest data, I think, which was for last year, it went to 56%. So a 10 percentage point increase in the pay bill over like 3 years.
Yeah, so these are quite big increases. So I say you'd expect there to be some impact. The question is, is that happening? How big is the impact? And how does that affect sort of the value for money considerations around this, particularly given, other pressures? And for example, should you be investing more in capital in the NHS? One of the things I often say about the English NHS, and I'm sure it's the same for Scotland as well, is that actually, one of the kind of big differences between other countries is the capital investment into new facilities and diagnostic equipment and so on. So there could be trade-offs between the sort of resource, the pay side of the budget, and the capital side of the budget as well.
Can I mention something on teacher pay while we're on the subject?
Yeah, go on.
Illustrate another trade-off. So that higher education resource spending line I mentioned that funds the teaching grant for universities was set to go up by £20 million in 2023-24. During the year, the Scottish Government then confirmed that increase wouldn't happen, so there was a £20 million cut. And that funding was instead redeployed to fund teacher pay pressures in schools. So now it means universities are in a worse position and go into the next budget with another cut. It just illustrates some of those trade-offs being made amongst the areas that are devolved.
Thanks. Yes, that's really interesting, Kate. We've got time for maybe one or two questions left. Sorry, I haven't had a chance to get through to your questions. There's one here which is a little bit different, and I'll try to answer it very quickly so we have 1 minute for the final question. And it's a very difficult fiscal environment. Will this be grasped by the parties in terms of the manifesto commitments for the UK and Scottish elections? I think probably we will see commitments to maintain debt on a downwards falling, or to get debt on a downwards falling path, with potentially quite significant spending cuts penciled in for certain areas to do that. What might happen after an election is you see those plans revised. Tend to see, in most of the elections over the last kind of 20, 30 years, taxes have tended to rise after the election. So I wouldn't be surprised if what we see before elections in terms of the tax and spending plans ends up quite different after the elections. And we also saw that in the Scottish election in 2021, the parties were offering, big expansions in sort of, service provisions and offers, many of which, some of which have come through, but many of which haven't come through in the kind of, in the sort of programme for government so far, at least in Scotland. One final quick question before we wrap up. And maybe this is a quick one. Kate, do we know anything about how part-time work has changed for students? There was this big fall in living cost support, you said, over time. Were students having to work part-time to make that up? Is there any evidence on that, whether from Scotland or from England?
So we think that's been the case in England in the last year or two, where the support hasn't increased as much. It's a bit harder to tell for Scotland. It's not something I've looked at in particular. Two things I would say. One is that it looks like take-up of living cost loans in Scotland is much lower. So around 95% of students in England and Wales take up some loans. It looks like only 2/3 do in Scotland. So more Scottish students are choosing not to take any loans towards the living costs. Also, the increase in the national living wage, which was substantial this year, will be substantial again in April, will increase the amount people can make from a given hour of part-time work if they're on the minimum wage. So extra appeal of part-time work, perhaps. Maybe you have to do fewer hours though. And also just
I hope everyone's enjoyed today's event. I found it, even though I've read all the chapters and wrote some of them as well, I found it really interesting, and I hope you did too. So thanks for joining. We'll be continuing our work on Scotland over the coming year with further work planned. Yeah, have a good day, everyone. Thank you. Good day, everyone. Thank you.